This one is undermined edges, which is seen in tuberculosis. This is punched out edges, seen in gummatous ulcer and trophic ulcer. This is sloping edges, which is seen in healing ulcers and varicose ulcers. And this is beaded edges, which is seen in rodent ulcer. And this is everted edges, which is seen in squamous cell carcinoma. Okay. Floor is generally covered with the red granulation tissue when the ulcer seems healthy and healing, and pale and smooth granulation tissue indicates slow healing. If there is black mass on the floor, it is seen in malignant melanoma. The character of discharge, a healing ulcer will show scanty serous discharge, and a spreading ulcer and an inflamed ulcer will show purulent discharge, and a tuberculous ulcer will have serous sanguineous discharge. The surrounding area, which is if it is glossy red and edematous, it is seen in acute ulcer, and if the scar or wrinkling in the surrounding skin, it is seen in the old case of tuberculosis. Okay, so we have to examine the whole limb. In case of an ulcer, the, there can be a for the checking the presence of varicose vein and deep vein thrombus. Then we have to do palpation. सबसे पहले we'll be doing we have to check temperature, then tenderness. Acute inflamed ulcer will show they will be very tender, and chronic ulcer might be tender but they'll be only slightly tender. Varicose ulcer may not and may be tender. Neoplastic ulcer are never tender. Edge and margin we have already discussed. What is edge, what is margin, and we have to check for the induration of the edge, which is characteristic features of the carcinoma. Okay, and then we have to check the base of ulcer, as also we have discussed how to check the base. If this is suppose this is ulcer, and then we'll hold the ulcer with the thumb and index finger and try to move it. When we try to move it, that is how we feel the base of an ulcer. Okay, so in cases of induration and hardness of a base, it is seen in squamous cell carcinoma and Hunterian chancre. Then we have to check for the depth of the. Then the bleeding. A bleeding ulcer is characteristic of malignant ulcer when under its relation to deeper structure. For example, a gummatous ulcer is fixed to the subcutaneous bones, and malignant ulcer fixed to the deeper structure due to infiltration. Surrounding skin, temperature, tenderness we have to check, and mobility of the skin. Fixity of the deeper structure to the deeper structure is also we have to check, and feel the main arteries. Then we have to examine the lymph node. For example, in case of tuberculous ulcer, they are large, matted, and slightly tender. In Hunterian chancre, regional lymph nodes are discrete, firm, and shorty. It is a pathognomic of hard chancre. In gummatous ulcer, lymph nodes are usually not involved, and in rodent ulcer, lymph nodes are not affected. In case of malignant ulcer, lymph nodes are stony hard. Then we have to check for examination of vascular insufficiency, especially in cases of varicose vein. Um, then we have to palpate the arteries proximal to the ulcer. In cases of atherosclerosis, Burgess disease, and Raynaud's disease, there is poor circulation. We have to examine nerve lesion. Trophic ulcers develop as a result of repeated trauma. Therefore, one needs to check for the nerve. Alright.